Bleeding after sex, what you need to know. Many of us may encounter bleeding during and after sex, which can be disruptive. Why does it happen, and how can it be managed? Here, an expert provides insights into these questions. Imagine this scenario: after intimate moments with your partner, you head to the bathroom for a sensible, UTI-preventing post-sex pee. As you wipe, you notice bleeding. Experiencing bleeding after sex can be concerning, prompting thoughts like, "What's wrong with me?" However, you're not alone. Up to 9% of menstruating women have encountered postcoital bleeding. It's a common occurrence that often doesn't indicate something serious. Postcoital bleeding, medically known as non-menstrual vaginal bleeding immediately after sex, is generally benign. While it may be reassuring to know it's common, it's still wise to consult your doctor to ensure everything is alright. Learn more about why postcoital bleeding happens and what steps to take if you notice blood on the sheets. What is postcoital bleeding? The term coitus isn't commonly used in everyday language, and it's understandable why. It doesn't evoke romantic or sexy thoughts. Simply put, it means sex. Therefore, postcoital bleeding refers to any bleeding that occurs during or after sex, excluding menstrual bleeding. Discovering blood on the sheets after intimacy can be unsettling, especially if its source is unclear. Feeling concerned is natural, but understanding where the blood might come from can provide reassurance. Typically, it originates from organs and tissues like the uterus, cervix, vagina, or nearby areas such as the anus. Several factors can contribute to this, including sexually transmitted infections, vaginal damage, or vaginal dryness. How long does bleeding after sex last? Like many aspects of sexual health, predicting how long bleeding after sex will persist depends on its underlying cause. While some causes of postcoital bleeding can be managed at home, others may necessitate a visit to your healthcare provider for further evaluation and treatment. You might experience anything from a few drops, which may be less concerning, to heavier bleeding, which should prompt a discussion with your doctor promptly. The duration of bleeding can vary. It could last for a few minutes or potentially longer. If you have any concerns about bleeding during or after sex, it's important to contact your doctor. There's no need to feel embarrassed. Healthcare providers are trained to address a wide range of sexual health issues. It's crucial to communicate openly so they can provide guidance on the next steps. Is it normal to bleed after and during sex? Many people will experience spotting or bleeding during or after sex at some point. Determining whether it's normal depends largely on the amount of bleeding and its regularity. While some post-sex bleeding is common, it's beneficial to inform your doctor about it. If you've only noticed a small amount of blood in the toilet, you might feel like it's not a big concern. However, it's better to inform your doctor than to worry unnecessarily at home. On the other hand, if you consistently experience bleeding during or after sex, it's advisable to contact your healthcare provider. It's always prudent to schedule a checkup to ensure everything is okay. How to stop bleeding after sex? If you're unsure about what's causing postcoital bleeding, it can be challenging to determine how to stop it. That's why it's crucial to contact your doctor and inform them of the issue. While the cause of postcoital bleeding may not always be immediately identified, your healthcare provider will make every effort to investigate. As part of their evaluation, your doctor may schedule an appointment to discuss your medical history. They may inquire about any changes in your menstrual cycle, such as increased flow or irregularities, and whether you've noticed any spotting outside of your usual period. Remembering specific details about your bleeding patterns can sometimes be difficult. Additionally, your doctor may ask about recent sexual activity, the timing of your last pap smear, and any changes in the color, smell, or consistency of your vaginal discharge. They may conduct a physical examination to check for tears or irritation around the vulva and inside the vagina, aiming to identify the possible cause of bleeding. Testing for infections may also be part of the assessment, and if it's been more than 3 years since your last pap smear, they may recommend one. While these tests and inquiries may feel thorough and personal, they are essential for your doctor to understand why you're experiencing postcoital bleeding and to determine the appropriate treatment to address it. What causes bleeding during or after sex? As previously discussed, there are numerous reasons why bleeding might occur during and after sex. While starting your period is a straightforward explanation, if you're certain it's not menstruation, what other factors could contribute to postcoital bleeding? Here are some potential causes. Damage to your vagina during sex. While there's often an inclination to believe that larger is better, thanks to portrayals in pornography, the reality is that a larger penis or sex toy can increase the likelihood of vaginal tearing and bleeding. During rougher sexual activity, increased friction can also contribute to tearing. Even if you enthusiastically consent to and are comfortable with this type of sex, it's important to recognize that the vagina is a sensitive and delicate area. Continuous poking, prodding, or forceful stimulation may exceed its natural capacity without proper care and precautions. If sex becomes painful or you notice bleeding afterward, it's essential to communicate openly with your partner. You may need to use more lubrication or extend the duration of foreplay to ensure both partners are comfortable and prepared. Remember, sex should be a mutually pleasurable and safe experience regardless of preferences. Ensuring both partners are comfortable and respecting each other's boundaries is crucial. Infections or inflammation. Bleeding after sex can indicate various infections and conditions. Some are related to vaginal imbalances, such as yeast infections and bacterial vaginosis. Additionally, sexually transmitted infections, STIs, like trichomoniasis, chlamydia, and gonorrhea can also lead to bleeding during or after sex. If you notice bleeding after sex along with symptoms such as abnormal discharge, pain while urinating, discomfort during intercourse, or swelling or rash around your vulva, it's important to consult your doctor. They will conduct an examination, recommend STI testing, discuss your symptoms, and outline appropriate treatment options. Vaginal dryness. As mentioned earlier, adequate lubrication often enhances sexual pleasure, whereas vaginal dryness, also known as atrophic vaginitis, can lead to discomfort and pain during sex. Fortunately, this condition is easily explained, and your doctor can offer effective solutions. Vaginal dryness can be associated with certain contraceptive pills, cold and allergy medications, and antidepressants. It becomes more prevalent as menopause approaches, typically around age 51, due to decreasing estrogen levels. Estrogen decline can reduce vaginal discharge, leading to thinning, dryness, and inflammation of the vaginal walls and vulva. Despite creating a dry environment, there are numerous straightforward methods to address this issue. To improve comfort during sex, especially penetrative intercourse, ensure you are relaxed and adequately aroused before beginning. Sexual arousal increases blood flow to your genitals, including the vaginal walls, which promotes natural lubrication. Additionally, water-based lubricants can supplement the body's natural arousal fluid. For menopausal dryness, using a vaginal moisturizer daily helps hydrate vaginal tissues by being absorbed into the skin. It's advisable to apply it regularly, although it's prudent to consult your doctor before trying new products. Changes to your cervix. Your cervix serves as a small but crucial passageway that connects your vagina to your uterus. It plays significant roles such as dilating during childbirth and preventing tampons from getting misplaced. Growths on your cervix can potentially cause bleeding during and after sex. While the term growth might sound alarming, it's important not to panic. Your doctor can identify and diagnose these growths through an examination, and in many instances, they can be effectively treated. One condition associated with bleeding is cervical ectropion, where cells from the inner cervix, endocervix, extend to the outer surface. These cells are prone to bleeding, so contact during sex can lead to slight bleeding. Another possible cause of post-sex bleeding related to the cervix is polyps, non-cancerous growths within the cervical lining. In very rare cases, bleeding after sex could indicate cervical, uterine, or vaginal cancer, underscoring the importance of seeking medical attention. However, it's essential not to overly worry, as the likelihood of cancer in such cases is minimal. Keeping a record of instances of bleeding after sex or between periods can provide valuable information to discuss with your doctor during your appointment. It's advisable to schedule an appointment promptly without waiting to establish a pattern of occurrences. What causes bleeding after anal sex? The skin surrounding your anus is highly sensitive, making it susceptible to tearing from friction during anal sex, which can lead to bleeding and significant discomfort, often referred to as an anal fissure. Additionally, penetration with a penis, fingers, or sex toys can cause hemorrhoids, dilated veins in the anus, to rupture and bleed. If you experience bleeding during or after anal sex, it's crucial to consult your doctor promptly. While discussing this issue may not be the most comfortable conversation, it's essential to share your symptoms with a healthcare provider. They can provide appropriate guidance and recommend the best course of action to address your concerns. Bleeding after sex while pregnant, is it a reason for concern? If you're pregnant, you're likely aware that your body undergoes numerous changes, including the development of many new blood vessels around your cervix. During sex, these vessels can sometimes bleed. A small amount of blood without pain is usually not a cause for concern, but it's always good practice to consult your doctor about any new symptoms during pregnancy. However, if you experience heavy bleeding during or after sex while pregnant, seek medical attention immediately. The bleeding shouldn't be so rapid or profuse that it soaks through a pad, nor should it be as heavy as a menstrual period. Heavy bleeding during pregnancy is always a concern and warrants an immediate call to your healthcare provider. Heavy bleeding after sex, when to see a doctor. Whether you've seen a few spots of blood on the toilet paper after a post-sex pee or a larger stain on the bed, it can be challenging to decide when to see your doctor about postcoital bleeding. The bottom line: regardless of the amount of blood, you should reach out to your healthcare provider. Postcoital bleeding is definitely a reason to see your healthcare provider, even if it is not heavy and even if it hasn't been happening for a long time. If you enjoyed watching this video, don't forget to like, subscribe and turn on the notification bell, so you don't miss any new videos. Let us know your thoughts about this video in the comments section down below, and feel free to stay and enjoy it until the end. Also make sure to check out our next highlighted video, and we will see you next time. Thanks for watching. Please like, share, and subscribe.